I'll refresh Hoover. All right, perfect. Looks like we're good to go. Folks, thank you so much for being here. And thanks for putting up with the weird 10 seconds of like, are we on? Are we going? Are we there? We are there. Always appreciate the patience there. Well, good morning again. For those who watched our previous session, you saw me not long ago. For those who are joining today, welcome. We are very, very excited for this session. So I won't linger too long on logistics and housekeeping. But as a reminder, we would love to see engagement in the chat box, in the Q&A box, both embedded within the Hoova platform. I will keep refreshing my screen so I can see those pop in, hopefully, as they come in. And then I will field those questions to our speaker when she is ready, which brings me to the introduction of our speaker. So I am very, very thrilled to introduce Shelley Little, who is a public health nurse at the Benton Franklin Health District. She's worked in overdose prevention and substance use for most of her career. She focuses on community health by people living up to their highest wellness. She educates and trains in businesses, nonprofits, and festivals. Shelley, welcome. I'm going to turn it over to you, and I will be here in the background to field questions when you're ready for them. Take it away.
Super. Thank you, Alex, for that nice introduction. And feel free to ask questions if you see them in the chat during my presentation. Happy to take them at any time. So I put together this presentation. Am I going to die doing my job for a mortuary care conference a couple weeks ago? It was a Washington statewide conference. And as we were discussing it with Washington Poison Control, this is sort of applicable to businesses as well, and people who are out in the community. So although you're going to see the PPE and everything with the mortuary care industry, you'll also be able to apply it to whatever you do as well. Like Alex told you, I'm a public health nurse. I'm not an environmental health technician, and I don't work for OSHA or LNI. So I'm a nurse, and my field of practice is the medical field. So I love this quote by Paul Farmer: the idea that some lives matter less is the root of all that is wrong in the world. He was a medical doctor, and he did a lot of work in third world countries. And I think it applies very well to people who use drugs. His other quote for me: the area of moral clarity is you're in front of someone who's suffering and you have all the tools at your disposal to alleviate that suffering or even eradicate it, and you act. So overdose prevention is more than just carrying your naloxone with you. It is really about your capacity to not only be aware that there's a problem, what it looks like, but to act on it. So that's the call to action, really. I'm going to intro you with what BFHD did to combat stigma, and hopefully promote people to more action. It's a campaign we did in 2025, and I want you to listen to it. It's pretty good.
Now, you don't get these moments back. With your brother, the fun uncle, lifting your kids into the air, the coworker whose jokes make the day feel lighter, or the person whose stories keep you coming back. These are what people who use opioids really look like. And now, it's time for you to be a user. Use patience. Use understanding. Use preparedness. Use grace. And give them a second chance. Because these moments matter. These people matter. So use now. Carry naloxone. Be a user and save a life. Get yours at beauser.org.
Thanks for watching that. What I really like about that is the people, when we do surveillance and we do overdose fatality reviews, the people really reflect the people in our community who are dying. I think there's some unfortunate stigma out there that the unhoused population are the most at risk for people for dying, but truly the people that die from overdose are housed and usually in residences when they die. I always like to start these presentations, because I'm public health, with some data. This is Washington State data. You might be familiar with DOH opiate dashboard, and I have selected here the EMS responses. What is curious about the state, and you could, if you're not from my area, the Benton and Franklin area, you can look at the chart and see the darker the color, the higher the rate of overdose. And in the statewide, in June of 2025, 1,333 people died of overdose. And this next one is the median time in minutes that it took for the EMS to arrive on the scene. And this was also June 2025. So the number there is 6. And I always like to say to people, at what time does the brain die? At what time without oxygen will the brain shut down? And it's typically around 5 minutes. So if EMS, a median time is 6 minutes, which means it could be a lot longer, then we really need to do something to start the breathing and get oxygen to the brain so that these people have a chance of living. So 6 minutes, let's make sure that we are first responders and are there if a person needs it. Last couple slides on data. This is local Benton Franklin data. If you aren't from that county, you have your own data dashboards in a lot of the counties around the state. And this one has to do with who is dying. Who are the people dying by occupation based on their death certificate data. So as you can see, the top gray line, the rates of overdose in the construction, labor, and trade, the gray line, have sustained the highest number of deaths over this pretty much 10-year period of time. So that is an occupation that is super high at risk. And it makes sense. It's unfortunate. These people work long hours. They use their body all day. They are not always able to take work off to go to doctor's appointments if they have aches and pains. So they usually start using ibuprofen and Tylenol, and then some days it just doesn't work. The other concerning line, that's not the only reason, but that is a reason. The other concerning line is the pink line, which is the other occupation, which is rising steeply as of 2021. So we broke that down for you. The industries most at risk, the teal, is the automotive, and then it's the cosmetology industry, and the janitorial, auto body, locksmithing, and marketing. So you can see when we worked with our ad agency, those were the occupations that we wanted depicted in that kind of marketing for being able to act. So we did target those populations of construction, automotive, cosmetology. So is this what it looks like when you need to clean up after someone has possibly overdosed, or you go into your bathroom at work and you see some drug paraphernalia? Or does it look like this when you go into your neighbor's house, or you come to pick up your kids after school? Or maybe it looks more like this. So if there's drugs around in the environment, what are some of the things you would need to protect yourself? We all are very familiar with PPE at this stage in our game. Nationally, we have masks available, we have gloves available. That you might not be familiar with the PAPR, but do you need these? And would you need these in anything you do out in the public or in a business? So there are PPE recommendations for the minimal amount of protective equipment you would need is where it's suspected that illicit drugs may be present, but not visible. And a moderate level of protection is there's a small amount of drugs, either in powder or liquid form. And the highest level is large amounts of drugs in liquid or powder form. So CDC made a table for people, and we really look at this table as pre-hospital patient care because we're out in the community. And just nitrile gloves, if you suspect that there's drugs available, is really all you need. And when people do body recovery for mortuaries, usually the drugs on the scene are picked up already, and usually gloves are adequate. But I want to talk about the difference as we move into opiate overdoses, what the difference between an exposure to them and a dose of them is. So if there was a pack of cigarettes or coffee on the counter, we would all have exposure to those, but we wouldn't actually get a dose of it until we drank the coffee or smoked the cigarette. So there's a big difference between just seeing it, being exposed to it, drinking the coffee, and actually getting a dose of it, which for some of us, the caffeine in the coffee wouldn't affect me until I drank the whole 16 ounces. But if I smoked the cigarette, the nicotine might affect me in the first few puffs, and some people not until they smoke the whole cigarette, and sometimes two. So a small amount, a small dose of something is sometimes not adequate to give you a response of an overdose. But anytime it's a larger amount or it's a more potent amount, it could give you an overdose. So types of exposure: inhalation through your lungs, insufflation is snorting through your nose, insertion is also done for chemotherapy and cancer patients with some embedded seeds. Ingestion is through the GI tract orally. Injection is through your IVs, and absorption is through the skin and mucous membranes. So we're going to only talk about a certain category of drugs right now. There's lots of different kinds of drugs. There's depressants and stimulants, hallucinogens, inhalants, cannabis. We're only going to talk about narcotics and analgesics. So it's a specific type of drug that can cause an overdose, and something that we can do something about. So other drugs and food can cause overdoses, right? But we're only going to talk about this specific type of drug that we can do something about. So the opiates, you are prescription pain medicines, drugs made in commercial regulated labs. There's the names of them. As a nurse, I use these drugs every day in my practice, but drugs that are made in illegal labs are not as safe, and they are still similar in name, especially if you're buying them outside of the pharmaceutical industry. Why are these important? Is they affect your brain cells. So if you break your leg, the narcotics aren't working on your leg. They're working on your head to tell you that you're doing okay, you're going to be okay. So what do they cause? Short-term pain relief and sleepiness, which is great because people need to rest. They also decrease our respiratory rate and decrease our breathing. So it's really important with some of these drugs that short-term pain relief is really the key, so that we don't get people too sleepy. I also have this bias that people that come into my emergency room say and don't want any opiates at all because they don't want to become addicted to them, really sometimes harming themselves by not utilizing this pain relief they could have. And so they don't get out of bed and they get pneumonia, or they won't get out of bed to go to the bathroom and they get a urinary tract infection, or they won't stand up straight and they end up walking hunched over and end up with a sore back. And that's another cause of pain. So I really want you to know that if a doctor prescribes you these pain medicines, doctors know how to prescribe. They're very competent. They prescribe appropriately and in the right amount. And that communication with your doctor, you're using these drugs safely. So fentanyl was on the list. It is a regulated drug through the FDA. It is a very good drug. It takes effect in 1 to 2 minutes, and it lasts for 90 minutes. So for me as a care provider, I want something on board really quick. Like if you just had a quick knee surgery and you're going to go home that day. And if you come out of surgery in a little bit of pain, I can treat that pain right away. Some of the other drugs that were on that list, Vicodin and Dilaudid, they take longer and they last longer, like up to 4 hours. Fentanyl is a synthetic, meaning it's not made from a natural product. So yes, we have labs that are making these drugs in a regulated fashion, and we have them that are making them in an illicit fashion out on the street. So when you use pills or powder, the increase in use causes an increase in tolerance. The top picture is the M30s that are on the street, the fentanyl M30s, and they crush them or scrape them and make them into a powder. And you can see on the bottom picture, the gentleman is lighting the foil with the pill, the powder pill on it, causing it to vaporize, and he's using the straw or tutor to smoke in the vapor. He's inhaling it through his lungs. And then there's also rock formation and an injection type of use. Really clear, if you don't get anything else out of my presentation, fentanyl is not readily absorbed through the skin. So this dermal exposure, this is a slide. Thank you, Scott Phillips from Washington Poison Control, for supplying me the slide. This was a research article that was written up on a friend of his who actually came to work with after trimming his roses over the weekend and had spilled pure fentanyl onto his hand. And even though he had cuts in his hand, he had no adverse effects for breathing or slowing his heart rate down or blood pressure. And he left that liquid fentanyl in his hands for quite some time without any ill effect. So anytime that you see these YouTube videos or anything where they just touch the substance or even inhale the substance, it takes quite a dose of it for it to do anything. And this is a great example of how the skin is a great barrier and likely not a cause of overdose. There is fentanyl patches you might be aware of. That medicine in the patch is tainted. It's supplied with a different chemical to break the skin down so that you can get the 12 hours of relief from the fentanyl test or patches. So here's your difference. For medical, fentanyl is produced in regulated labs with oversight, accurately packaged and labeled, doctors prescribed and legal, safely used by chronic pain and cancer patients to alleviate severe pain and unrelenting pain. So illicit fentanyl is produced in underground labs or illicit labs with no oversight, not labeled, and no way to know what's exactly in them, which is one of our other concerns. And it may be mixed with other drugs, not realizing it. And it does carry a high risk of overdose. So what is overdose? Overdose occurs when someone takes more of a drug or food into their body than they can handle. So an overdose overpowers that brain, like we talked about, and other organs, preventing them from functioning right. What we need to do is restore the breathing. They don't always stop the heart from beating. So opiates in general tend to slow your breathing down to where you aren't breathing anymore and you will still have a heartbeat. The 911 procedure, though, we'll get to that, does say to start CPR right away because that is the only way to circulate the oxygen. So let's just say you're outside of a house or a business and you see a man sitting on the curb, nodding off and slumping over. You don't know if he is awake or asleep. And so what do you do? We do have an antidote for an opiate overdose specific to opiates. It's called Narcan. We also call it naloxone, as that's the brand name as opposed to the trade name, that will reverse an opiate overdose. So there's certain drugs, certain benzodiazepines have reversal agents. Aspirin has a reversal agent. Certain drugs have them, and certain conditions or other drugs don't have them. So naloxone will reverse the effects of an opiate. And this is how I'm going to show you. The opiate is the orange circle, and it is in your brain taking up part of the space where your neurons are. And when you squirt naloxone up someone's nose or inject it IM or in IV drip, it takes about 2 to 3 minutes to take effect. And what it'll do is go into that blood-brain barrier and kick off that opiate and take up its space. So if it isn't a drug overdose, let's say it's low blood sugar or someone had a seizure and they're postictal right now, it won't harm the person if you give it. It just won't work. And let's say it is other drugs that are in that space, it won't work for that either. But it is effective for almost an hour for being in the space. But it takes 2 to 3 minutes, whether the person's breathing or not, to take effect. So what do you do? How do you respond and what does it look like? So this person sitting on the curb, they won't wake up. They have slow or no breathing, heavy gurgling sounds. Their color is blue or gray, and sometimes they're cold or of clammy skin. So this is what some of the blue lips and fingertips look like. So what do? It's this typical CPR response. You do a verbal, right? Hey, are you okay? Hey, I'm Shelly. What's going on? Do you need some help? Same thing if someone's in a car, if they're somewhere else and you knock on the window. Are you doing okay? You just talk to them. The next thing you do would be a physical response, which is checking to see if they will wake up. I'm not a big fan of that sternal rub people talk about because it puts your face over the person. And a lot of people that overdose have had some type of trauma or some type of interaction with people who aren't nice to them. And so to have a face over them, if they were just sleeping and they wake up, it's pretty scary. So they get disoriented. I would do what we call the trapezius squeeze, that space above your clavicle, and just inject your thumb right in there. And if it's enough of irritant that people will wake up if they're asleep and not overdosing. And then you call 911. So if you have Narcan on you, which I'm hoping you all do, somewhere in your purse or somewhere in your pockets or however you backpack carry around, then you would give the Narcan with it through the nose or IM injectable into a muscle, and make sure you call 911. 911, I would put on speakerphone and I would say, I'm with someone who's stopped breathing. You're not looking for them to pop straight up and awake immediately. You're just looking for them to start breathing again. So sometimes they will just start their breaths again, and that's how you know that your Narcan is working. A lot of times people give another dose after 2 or 3 minutes, but you would want to wait at least that amount of time to see if it will work. Because like it said, it takes a minute to get to the brain, 2 minutes. Narcan comes in 2 doses in every box. And if you have to leave to go get to a phone or something, I would put this person in the recovery position. What they really need, I've mentioned before, is breaths, not necessarily CPR. So give them space. This is a video from Narcan, from the product, and they show an actual recovery of someone and how to give the drug.
Narcan nasal spray is an emergency treatment designed to rapidly reverse the effects of a life-threatening opioid emergency. If you suspect an opioid overdose, check to see if the person will not wake up, is very sleepy, or is not breathing well. Do not test the nasal spray device before use. Narcan nasal spray is for use in the nose only and is safe to use even if opioids are not present. Hold the nasal spray device with your thumb on the bottom of the plunger. Insert the nozzle into either nostril and press the plunger firmly to give the dose. One nasal spray device contains 1 dose of medicine. Call 911 immediately after giving Narcan nasal spray. If the person does not wake up, continue to give doses every 2 to 3 minutes until the person wakes up. It is safe to keep giving doses. Stay until an ambulance arrives, even if the person wakes up. You have the power to save a life. For more information, visit Narcan.com.
So I want to talk a little bit about a kind response. If you are the responder, your heart rate's going up and you are probably not in a comfortable place yourself. But people who have overdosed are usually not intending to overdose. So they are also, it's like tripping up the stairs. They're confused. They don't know what happened. They're embarrassed. So welcoming people back in a friendly manner is really important. If you can calm yourself down, you just say nice things like, hey, introduce yourself. It starts with waking them up slowly and saying, hey, I'm Shelly. I think you overdosed. I gave you Narcan. You're starting to come about. Just sit here with me. Do you want a drink of water? And give them space. Kind of keep it quiet. If a crowd is gathered, going to try to keep people away. They'll usually talk to you. Hey, what happened? and you just tell them what happened again and stay with them and tell them I called 911, EMS is going to show up. And if they want their belongings with them, if they need their special person or their dog, you just let them have those things and tell them that they're doing good. A little bit of talk about the Good Samaritan Law. There's 48 states that have the Good Samaritan Law. Washington has a really good one. It protects both the overdose victim and the person responding. So if the victim has drugs in his pocket, he won't or she won't get a charge for possession. If you injure the person while responding, let's say you pull them out of the truck and they hit their head on the ground, which you should be trying to get them to a flat ground, because CPR would be next if they didn't wake up, you cannot be sued for injuring the person during the recovery. Things that the law does not cover are things like a warrant for someone's arrest. They can still get taken to jail for that. They don't cover things like grounding at home or rules for school if it happens on school grounds. So those are outside of the law. There still might be repercussions for that. But minors typically get nervous to call 911 too, especially if there's alcohol on board or people are at risk for losing a scholarship. And what we really need the community to know is that they're not going to get a minor in possession charge. The cops are typically going to leave them alone. So we need people to call 911 and get help on the way. So this was a case scenario for the mortuary company, but let's say they were getting you went to a house and there was somebody who was on a recliner. There were drugs next to the recliner. There was a fan nearby. What would you do? The coroner was wearing gloves. Law enforcement was not wearing gloves. For the mortuary company to come pick up the body, the family's outside. So the biggest risk here is the fan. So typically law enforcement, before they call a coroner to the scene, have removed the drugs. So this is a real hypothetical. But if it were you, you could just ask that the fan be turned off and the drugs be taken away. So again, this is more death care sector of their risk of removing materials from their pockets and storing their clothing in locked cabinets and away from staff. Moving on to prevention, because this is where the sweet spot is of what we all can do. This is a busy picture, but the bottom, the ambulance is the highest level of care. It's the most expensive level of care. As you move up the cliff, you can see that there's secondary prevention things, screening people, collaborative case management, and then primary prevention is really where it's at, where we mentor people, we write policies, we write legislation, and get people as far away from the edge of the cliff as we can. And so what we can do together is something called collective impact. And the major driver in decreasing the overdoses over the last 3 years has been our collective impact of all of our interventions. So naloxone distribution is huge, expanding access to treatment and paying for that treatment, and harm reduction services, as well as preventing new addictions. So Dr. Dasgupta is a very renowned doctor in toxicology, among other things. But he says now more than ever, we must double down on our investments in overdose prevention, harm reduction, and treatment to continue the momentum to save more lives. It's really call to action that even though we see deaths decreasing at this stage in the nation, they're really slow in rural areas to start to decrease, and together we need to combine our efforts to continue the decrease. So we ask for things like pick up baskets in the lobbies of places so people could just low barrier pick up naloxone if they need to. We also talk about leave behind doses, and I give strategies for conversation with people. If you're one of those agencies that actually are out in the community doing food or doing outreach, just emphasize concern for the person. No slip up should be fatal. Can I give you a box of Narcan or naloxone just in case you are around people who might overdose? People and also kids really like the ability to help others. And so you might offer your box of naloxone to somebody who you might know their parent might be using drugs and they might need it in their backpack to take home with them. So we talk about leave behind, and the health district has also put out some more information on leave behind, what to do in the next few hours after somebody has overdosed, what to do in the next few days, and then where to get treatment and how to get help. We have put together some numbers. So the other things to consider, we are rounding third base now. We are almost done with this presentation, but let's look at some of the environmental health things like expirations at the top of your box. If you do have naloxone, they're typically 2 to 3 years. The FDA did approve an extension of 3 years, but they're effective much longer. We have research now that shows that they can last up to 30 years. So the bottom line is, if you have Narcan, you don't know where it came from, you don't know if it's expired or not. The thing is just give it. Also, people tend to keep these in their car, so not at room temperature, which isn't great. And we're going into cold weather here eventually. So what happens if it freezes and then thaws? Is it still good? It is still good. Cleaning up where you find drugs is typically just soap and water. Fentanyl is similar to cannabis in that it's lipophilic, it's stored in your fat cells. And when they blow it out in smoke form, that's a water vapor. So not to say that you couldn't go in a bathroom after someone's used and get a headache, because some of these drugs are, they are caustic, and so that people will know the difference in the smell, but they're not going to cause you to overdose. They're just an irritant. So you would also clean up with soap and water, throw the foil and the tube or the straw in the garbage can. If you find needles, then put them in a plastic bottle, screw the top on, and throw them in the trash. Other great prevention mechanisms are the lock boxes. And cannabis stores have done this really good using the sealable packs, disposing of your drugs in the take back boxes, the blue take back boxes that we have in Washington State, and even just keeping pills or any kind of drug paraphernalia in even a SNAP container keeps them away from children or other people who shouldn't have access to them. Carry your naloxone, and talking to our friends about medications and use and what our kids are doing is really important to have these conversations. So where do you get it? It's an over-the-counter drug now. So you can get it at any pharmacy. You can get it usually at CVS, some Rite Aid. You can actually go to a Washington State naloxone finder. And there are pickup locations in every city, usually. Well, not every small town, but every large town city. You can also buy it off of Amazon for $29.99. So in the store and the pharmacy, it's typically $42 to $56. So you can actually get this online if you want it. Wanted to thank Enan's in our area for helping me. And the next one is just a couple of videos. If we have a minute of time, I'll play them. Some of the words in these are great. So I want you to listen to a couple more videos and then we can wrap it up.
Because her next story beats any podcast, and missing it would be a true crime. Use friendship, use understanding, use a second chance. Hairstylists are among the most at risk of opioid overdose. Naloxone can save a life. Find out where to get it at beauser.org.
Here's another one.
Because his jokes make you laugh harder than you work. Use perspective. Use hope. Use a second chance. Trade workers are among the most at risk of opioid overdose. Naloxone can save a life. Find out where to get it at beauser.org. Because buddies like this can make a brake pad change feel more like break time. Use care. Use your time. Use a second chance. Mechanics are among the most at risk of opioid overdose. Naloxone can save a life. Find out where to get it at beauser.org.
Thank you for having me again, Alex, and Washington Poison Control. I really appreciate the chance to present this year, and if we have any questions, happy to take them.
Excellent. Thank you so much, Shelley. Let me refresh the chat box to see what's coming through. I have a comment while I'm waiting for questions to come through. Kind of a few comments, but they basically boil down to that was awesome. As an educator in a poison center, I really appreciate it when folks define exposure versus dose and like really break down what do we mean by this term dose or overdose and all of that. I uh I also really appreciate you breaking down a lot of the true risk around just general secondhand exposure to opioids specifically in this case. But I think, one of your slides, one of your big prevention slides, it really aligns with so much of what we say in the poison center world of like one of the best prevention steps of any overdose to any substance is safe storage. Like so much comes down to safely storing drugs, safely storing alcohol, also a drug, but we frame it as separate a lot of the time. Safely storing cleaners, chemicals, all that. Lock it up, keep it up high, keep it out of reach. Just those few steps can help prevent so much. So thank you for walking through that. Okay, so I did catch a question here. This was first a comment, great slide on transdermal fentanyl absorption. Do you know if they happened to do a blood level test for that particular case with a fentanyl spill on the hand?
Oh, so I haven't read that in probably 2 months. So I can't speak exactly to the mechanism of how they figured that out.
Sure.
But I could go back and it is cited on that slide, and I'm happy to share the slides.
Perfect. Thank you. Folks, we'll be sure to get those slides all uploaded properly into the Whova platform so you can access that at a later date. A connected question by the same person. Thank you, Seth, for these questions. Do we have data on nitazene absorption through the skin that you know of?
So nitazene is a different product. It's an alternate to a lot of the fentanyl that's out there, but it is totally different. So Narcan isn't going to work on nitazenes. It is a different component altogether. So do we have data on them? Not specifically as far as overdose goes, but they are the latest trend, Seth, and they are coming. We haven't seen them a lot in the Pacific Northwest now. Through our drug checking, University of Washington, you can log on their website and find the drug checking information through our syringe exchanges, and they will talk about what components are in our drugs right now.
All right, thank you. All right, folks, hit us up with any other questions. There's a comment, just someone saying they love the be a user ads. Very clever. I agree. I also love a good pun. I liked the true crime pun they threw in there. That was good. And kind of playing with the term user. I think that's clever. I think that's really cool.
Thank you.
Okay. Well, I'm going to do one last refresh on Whova, but then we might end just a couple minutes early, which I'm sure folks can use the time to take a bio break, grab another cup of coffee. Yep, I'm not seeing anything else there. So, Shelley, I'll just ask you any final thoughts you'd like to leave our attendees with today before we go ahead and wrap up.
Well, thanks for coming, and thank you for supporting the work of everyone around the state of Washington's work and being interested in this opiate summit for overdose. Very thankful for the Poison Control for continuing to do this on Tuesdays. Last year, I think it was Wednesdays. But yes, it is very good to be part of a collective of people who are interested in saving lives and also having people that use drugs have decent respect for our community and live safely.
Absolutely. What a way to wrap up. Thank you so much, Shelley. I appreciate you taking the time to share your expertise. I also very much appreciate how like calm and straightforward you're presenting so much of this. So much of this information is very easily sensationalized, and I think I really like your approach of this is what we should be concerned about, and this maybe less so. So thank you for that. Well, folks, we will go ahead and wrap up this session. A reminder, our next session will be Trends in the Illicit Drug Market. That will be at 11:45 a.m. You can see the link to that in the Whova platform. Hope to see you all there. Take care, folks. And Shelley, thank you so much. Have a good one.